give you a quick rundown of how I am standing here today and how I got here, right? It first started when I got sick in India. Who doesn't get sick in India? Excuse me while I run to the bathroom. Oops, too late, right? Everybody gets sick in India, I included, but I had more than just stomach upset. I was really ill. In fact, I thought I had to be medevaced out of there, flown to Europe or somewhere, because I was bad news. Thankfully, there was a local Indian guy that I had met, and he took me to this doctor. At least I thought he was a doctor. And I went in there, he felt my pulse, he looked at my tongue, and he looked at my skin, and he started writing all this stuff down and told me to go away and take all these different herbs. And I looked at this and I said, how does he know what I have? Because he just felt my pulse. And then he goes, oh, that's Ayurvedic medicine. What? That's Ayurveda. Ayurveda is a thousands of year old medicine, and they use herbs and whoa. Give me some meds, give me some, check my, do x-ray, do CT scan, something. What's going on with me? No, get out of my office, go get these herbs. I had no choice. I'm stuck in the middle of Jaipur in Rajasthan, India, and I'm bad. So I go for it. My head is on the counter and I hear this guy chopping herbs and he's talking to me. While he's doing that, I have to get up and I have to go puke in the street next to a camel. I come back, he gives me these different herbs. I go to my hotel room. I'm desperate, I take these things. And I swear one was pile of cow dung. It stunk, didn't matter. I took it, I took these other weird pills, I drank this tea. There's like 4 things I took. 30 minutes. I was about 80% normal. What the heck was that? The guy didn't even do blood work. I was blown away. So Ayurveda was my first introduction. I gravitated towards that immensely. But then I really wanted to be a primary care physician. It wasn't enough for me. I'm a scientist at heart. I wanted to know why these things work and how they worked. So then I discovered Bastyr University literally in my backyard. I went to Bastyr. While studying at Bastyr University, I was there and you learn the basics. You learn the standard biochemistry, pulmonologies, all the ologies, standard medical school stuff. And it was interesting, but I wanted to get deeper into the biochemistry. I did that, I got involved in that, I loved it. And then I started understanding about what environmental medicine was and how the environment of food, lifestyle choices of smoking and drinking alcohol and chemicals of pesticides and herbicides in the environment, heavy metals, mercury amalgams in our patients, what these did to their biochemistry. I thought that was fascinating. So I really focused in on that, because if we could clean up the environment of the patient, clean up the mold, their asthma will go away. All these things would make a tremendous difference. But you know what? Some patients got better, some didn't. How is that possible? You clean up the environment, you give these prescriptions of sauna therapies and supplementation, and you chelate them, and one set of patients did phenomenal, others sick. And I said, God, there must be some genetic component to this. So I got into research, and I actually talked with some leading environmental medicine docs in the world, and they said, yeah, but we don't really have any way to check this, and we just keep pushing them through it. And it's like, but that didn't make sense. It didn't resonate with me. So I wanted to go and hit that. MTHFR was the first gene I identified. I looked at that, I was like, whoa, how did I not learn this in med school? MTHFR, cardiovascular disease risk, cancer risk, pregnancy complications, infertility, schizophrenia, bipolar. These things are huge. Not a word, not a peep in med school. I focused on that. I understood the mechanisms of that MTHFR did this and it did that and how you could optimize it. I started working with that, identifying it in patients. You know what? Some got better, some got worse. How is that possible? I did the environmental medicine, I did the naturopathic medicine, and now I'm doing the genetic stuff. Well, I identified one gene. There's about 23,000 others. And you know what? These genes communicate with other genes. So I'm treating one gene in isolation, but MTHFR is connected basically directly to 200 other genes. And those 200 other genes are probably connected to 200 or 1,000 other genes. So I'm giving one nutrient of methylfolate to someone with MTHFR, and I'm affecting thousands of genes. Well, no wonder there's variation in patients. So if you're treating one gene in isolation and you're ignoring everything else, you are going to be at fault just like I was. Don't do that. Identifying MTHFR is important. It's a tool that you use in addition to everything else that you do. You have to focus on the diet, you have to focus on environmental medicine, you have to focus on the therapeutic order of your patients. These are critical steps. Identifying genetic polymorphisms is important, but where I'm coming and where I'm going is the same place where I believe that you should be focusing on. My first conference of part 1 was focused on genetic polymorphisms. It was great. We learned a lot. I learned a lot. It was helping a lot of doctors. Then doctors came up to me and said, you know what, Dr. Lynch, I started applying these genetics things and some people got better, some got worse. And I said, oh, hold on. Are you looking at the environment? No, do that. And they started doing that again, but some still suffered. So that's why I'm talking now about the core organelles of your patient, the mitochondria and cell membranes. These are core issues. So we have to go to the core sometimes after you understand the basics are being done. So that's where I'm going. I'm evolving all the time in my understanding of the patient's biochemistry and how we get stuck as physicians. So continue to evolve. Medicine is an art. That's why people say, I practice medicine. Thank you.